be as 2 sessions. We are looking at environmental strategies, and when you're thinking about environmental strategies, we have um, the opportunity to connect the environmental strategies to enhance those individual strategies. Those strategies are evidence-based, and they do create long-term and lasting change within communities. They also provide an opportunity to really build those alliances between community partners that you may not normally be working with. So if you've got a casual relationship with businesses or with your faith-based community or even your schools or other community members, it really is an opportunity to connect with them. And particularly when you're looking at businesses, it doesn't always have to be an ask for funds, but it can be an ask for engagement and to help you further your message. So think about engaging partners, particularly those within businesses, in a variety of ways. When we think of environmental strategies, they include those community norms and media messaging. It also includes access and availability and policy and enforcement. And the focus of today really will be with those the access and availability and within the realm of policy and enforcement. And along those lines, when we're talking about access and availability, we're really looking to reduce the perception of harm. Or when we're seeing in communities that we're seeing the reduced perception of harm. So when we're asking our young people and even adults about their perception of the risks, say, of marijuana compared to tobacco, everyone sees that use of tobacco is harmful to the individual, harmful to others, but when that question is related to marijuana, then a lot of times they see it, well, no, not only is it not harmful, it's medicinal, so it's going to provide a benefit. So we're seeing some of those challenges there. Particularly, or additionally, we're seeing some challenges with increasing the legal access to marijuana in a variety of realms, whether that would be through decriminalization or through medicinal or through recreational outlets, or just an overall less of an interest in pursuing or maintaining the laws that we have. Also thinking about or looking at growth of availability. So marijuana is increasingly legal, so that's increasing the availability. It's being commercialized now that there's retailers that can kind of develop and really market these opportunities. Also thinking of growth of ways to use marijuana, so thinking about the knowledge about, we have ways to use through what we see through the media that we talked about a little bit last time. Also, we've got additional opportunities to use through edibles and through vaping. It's also opportunities in growth in the actual cultivation of marijuana. So there's a lot of information about that in making a stronger strain or varying strains or marrying them together. And also looking at the growth of the marijuana market. We see a whole lot of commercialization now related to marijuana, and it is far less about those sick and dying people that the marijuana proponents like to kind of focus on, and more about really the marketing of marijuana and having it a consumable item. When we're talking about access and availability, kind of Webster's definition of access and availability is access is the means of participating in, and availability is, again, Webster's definition, the inverse of the sum of resources that must be expended to obtain a commodity. So basically what that boils down to is the more resources, whether that be time resources, money resources, or knowledgeable resources that it takes to get something, the lower the likelihood that it will be obtained. And I look at that personally, and I look at a lot of cars that travel on the road, and if I'm thinking about access and availability, that pretty new Mercedes is going to be a whole lot harder for me to access than a Kia would be. So thinking of what the challenges might be in order to access those said commodities. And when we look at access and availability, I like to think of it in going back to kind of my marketing days of what we see through the 4Ps. So the first of the 4Ps is price. So we've got wonderful resources today, and we've got priceofweed.com that will help you identify what the prices of marijuana are, and they have varying levels of quality. So you've got your high quality, you've got your mid-range, and then you've got your low quality. marijuana. So you can just go to priceofweed.com and that will map that out for you. Also, we had, I saw this article from the Chicago Tribune, this is back in September, and really looks at the average price and has it based on whether marijuana is allowed medicinally, whether it's permitted recreationally, or it's not allowed at all. And we see that marijuana street prices are lower in areas in which that it's allowed medicinally and recreationally, which really isn't surprising because when we look at access and availability, we know that the greater the access is, the lower the demand will be. So that's going to impact price. So price within marijuana as a commodity would be consistent with other realms as well. So we could see that through the more legalized area, that prices is a lot lower as well. Going along with those 4 Ps, we also look at place. So place, we have medical marijuana, which is kind of where we started as a country in getting things legalized, and it's all for the sick and dying people. But the place has kind of expanded a little bit now, so it's not necessarily just for medicinal outlets, but also for recreational places as well. And if you are interested in working in this type of market, then there's other sources as well, such as an opportunity for delivery drivers to bring this wonderful commodity to you. So thinking of place has evolved over time. There's the internet that's going to help with that place. It's not just the shops that we traditionally see. It could be some other outlets as well as home delivery. Moving on to promotion, last week we talked about, or last month for session 2, I had mentioned that when we're thinking of marijuana use, it's predominantly males, and I was corrected by, I believe her name was Susan in California, to say that while use is predominantly males, and a lot of the celebrities that we see promoting marijuana are males, there is, in looking at kind of changing the marketing for marijuana, we see a lot of interest from females. So I wanted to kind of point that out. And we've got Jennifer Aniston here, who is an actress and philanthropist, according to this nice little ad from Normal, and she enjoys smoking cannabis and sees no harm with it. So we see that. And then we see this other young lady here in trying to expand marijuana within a state, and she prefers marijuana over alcohol because it's less harmful to her body. I don't know that that's necessarily the case, and we have some pretty clear low-risk guidelines related to alcohol, and I don't believe that those exist related to marijuana. And we'll talk about some of the resources that we've developed for you a little bit later on the call, but just wanted to bring some of those out there. And then, of course, we've got Cannabicare, or Canacare, and cannabis will relieve diabetes and chronic pain and hypertension and all these other horrible things. And again, it's an important piece to note that when we're talking about marijuana legalization, a lot of times they don't use the term marijuana, but want to replace it with cannabis to make it appear that cannabis is much more medicinal and is not necessarily as recreational as marijuana when it's all in the same thing. So then we've got your medical marijuana evaluations through Happy Medical Center, and they range from $35 to $45, so it's such a convenient thing for you. And then we've got some diversity here, and want to make sure that we're culturally inclusive with our messaging. So we've got the Spanish phone number that you can call to get that great information about medical marijuana. And then I thought this was interesting when we're looking about when I was researching for the edibles, and this little thing here from Normal, and it says help reform marijuana laws, and it's just a tag on in the brownie section of the grocery store. So I just thought that was kind of interesting when you're looking at promotion, and not necessarily is the promotion specifically toward the product, that there can be some cross promotion as well, as in with these wonderful Duncan Hines brownies that we see. Then moving on to the 4 Ps, there's also the product. And traditionally, we've seen marijuana product as the leaf that can be smoked, but it's kind of expanded from there to now that there's beverages that include marijuana. There are lollipops that include the marijuana oil, or you can just buy the cannabis oil and include that within your baked products. So this wonderful image from DEA really shows the marketing and kind of how they've taken things away from what we normally know in terms of brands that we're loyal to, such as Oreos or Reese's Cups or the Crunch Bars, and they've marijuana-ized them. So when we think about marijuana expansion, it really is focused commercially and is really focused in those realms. So we've got our Twixt and our Keith Kat and our Butterfinger. So all these things here, and some of these companies are suing these producers for really infringing on their trademarks because they're taking products that are well known and kind of morphing them into the marijuana land. And it's not only challenging from a trademark perspective, but also challenging from a young consumer perspective. So if I have a child that sees a Reese's package, they're not really going to understand the difference between the Rasta Reese's and what we'd see in the traditional Reese's cup. So when we're thinking about effective strategies within access and availability, we really want to look at looking at reducing access at home, at schools, at recreational areas, and other areas. So when we're looking at reducing access at home, making sure that if you're in a state where marijuana is legalized, that we don't have the edibles in a place where young people can access them. We want to make sure that it's appropriately controlled, and also in areas where it's not legal or where it is and we just don't want to have youth access, being more mindful and aware of what some of the concealment methods might be. There's a great training that we have here in Ohio called Hidden in Plain Sight, and I'm not sure if that's available for your community, but it's a great opportunity to really see some of the hidden methods in which drugs can be concealed in plain sight. So in tissue boxes or other areas that would something that would be easy to overlook. So when we're looking at effective prevention strategies, we want to make sure that we're appropriately educating the right audience. So hidden in plain sight is a great educational tool for parents, but would be something that youth would not be great for them to have access to. Also thinking about availability at schools. So we want to make sure that the school resource officers are engaged and knowledgeable about what the state laws are or what local ordinances look like. Also be knowledgeable of what the school policies are. And we want to make sure that it's not just the school resource officers that are engaged in these areas, but also other folks that are in the schools, such as the administration, the teachers. How engaged are your lunch personnel or your bus drivers? Are they knowledgeable? Do they know what to look for? Because when we're looking at access and availability, particularly within schools, we know that a lot of times that things are passed off is not within the classroom, that it's in other areas such as lunch or on the bus or when they run to the restroom. So we want to make sure that those areas are well overseen. And then finally, recreational areas. So are the parks areas where marijuana or other drugs can be passed off, or is that a meetup spot? Are there carryouts in which things are happening, or even your local restaurant, say McDonald's, is the spot to change things? So when you're thinking about restricting access and availability, really looking at advocating for community-wide education. So we're looking at educating not only parents and not only students, but also your elected officials, your business members. So when they go to that McDonald's, that the managers are trained and are knowledgeable of what to look out for. Also looking at addressing those unmonitored locations. So is there areas within your community in which there's not a whole lot of monitoring, such as a park or an abandoned house where some activities that are not so much for the betterment of your community might be happening? And are there some high-risk outlets? So is there a place where it's depending on where you're at, if it's a outlet where marijuana is consumed or sold quasi-legally, is that being appropriately monitored? Are those laws being appropriately enforced? Or say in head shops or other outlets that might sell paraphernalia, making sure that marijuana is not being sold through them, or synthetic marijuana, which are some things that we still see popping up occasionally here in Ohio, where the K2 and Spice and other products have been outlawed, but they're still kind of sneaking in and are available back of house or under counter where you might not be able to see them. So just kind of having those communications with your local law enforcement and other community leaders about what is appropriate and kind of addressing some of those unmonitored locations. So it's also important to know your community. So do you know where the high-risk outlets are? Do you know where the unmonitored locations are? And having that as a conversation point for your community groups and making sure that those are being appropriately addressed. And if you think you know, how do you know? Are you hearing from parents? Are you hearing from students? Are you hearing from law enforcement? Are there other entities that you may not be tapping into? And who else might those other entities be? So who else can you ask to kind of engage them further and get them connected to what you're looking for? And then what are you, as you collectively, the community, not you just individually or your coalition, going to do to address those high-risk outlets or those unmonitored locations? So what do they look like? What are you doing to kind of get that message out there and really getting things communicated to you? When we're looking at other environmental factors, looking at that in policy and enforcement piece, those are important areas in which to effectively engage. So want to make sure that we've got policies or rules and enforcing compliance with those rules, which shape how alcohol, tobacco, and other drugs are promoted, sold, and consumed. So thinking about the community that you live in, what are your current laws? What are your policies? And do you have regulations or ordinances related to marijuana? And if you don't, why don't you? So want to make sure that you have thought about that from policy, kind of a big P perspective. When we think about policy, it can be big P policy and little p policy, we call it. So the big P policy would be your state laws, your local ordinances. The little p policy would be things that are a little bit more easier to engage or connect with. So those could include things like local or school policies. It could be recreational policies for your park. It could be policies for organizations to kind of work collaboratively together, or it could be other things such as informal policies that you have, or even policies within workplace can be big P or little p policies. So want to make sure that those are connected with. And when we're thinking about the big P policy, do you have laws in your community, and do those laws include decriminalization, medicinal use, recreational use, etc.? So thinking about those policies and how those might fit within your community. So when we're thinking about those policies, do they include some of the common things that you want to make sure that you have covered? Do they include use? Do they include the sale, possession, cultivation, and production? And cultivation is kind of what we normally think about, but as we have marijuana continually expanded, that production piece really comes in, particularly when we're talking about the oils and the edibles and making sure that things are done appropriately. And is transportation covered there? So are there policies in which you're not able to transport your marijuana from one place to another, or making sure that you're bypassing those areas? And are there policies related to research and testing? So in looking at the marijuana legalization efforts here in Ohio, one of the pieces in this bill to pretty much monopolize marijuana legalization in the state, they set up the test sites, and they have them located throughout the state. They set up the grow sites, and they're located throughout the state. And in that language there, which they set up who controls the production, who controls everything, they also have it written that local ordinances are prohibited and cannot bypass this law that will be an amendment to the state constitution. So when we're looking at policy, whether it's for expanding marijuana or if you're looking to prevent marijuana, certainly we don't want policies to expand marijuana, but you want to be mindful of what those policies entail and how they might supersede some of the policies that you already have in force. So thinking about that and how that might relate to you and your community. So thinking about your current laws within your community, the regulations and ordinances, do you have, or What do they have related to marijuana? Are they appropriate? Are they sufficient? How well are they being enforced? And are they being enforced consistently? So think about that. Have communications or connections with the folks within your community to make sure that that you have laws that are appropriate, you have laws that sufficiently cover everything. You make sure that they're being enforced. That's where law enforcement is really important to come in. And then finally, making sure that they are being enforced consistently. And moving on to that, we're looking at marijuana in the federal law. And here we'll try to turn things over to Tony. And Tony, I did send you your audio pin, so you should be able to log in here shortly. So we're looking at marijuana from the federal level, and we talk about marijuana legalization, but in all aspects, marijuana from a federal perspective is illegal. It's illegal under the DEA. The FDA doesn't see any reason to legalize marijuana, so wanted to turn things over to Tony and have him talk a little bit about that. Tony, over to you.
All right. Thanks so much, Derek, for letting me be off-site today. You're about ready to meet, actually, about marijuana with a state legislator here. Marijuana, a lot of times, a lot of blame is placed on the federal, including for myself, upon the federal government or state government and allowing certain things to happen. And right now, under federal law, I mean, it's still, marijuana is still a Schedule I illegal drug. And no matter what any state law says, it's still illegal federally, which causes all kinds of problems with workforce, with anyone with a DOT, a Department of Transportation contract, or OSHA, or drug-free workplace policies. So you have that, almost dichotomous relationship of state versus federal law. But basically, what the federal government has said is they're going to take a wait-and-see approach. It's even been called an experiment. That the Department of Justice, the former Attorney General Eric Holder, has said it's an experiment, that they're going to see how things happen. And we know at the federal level there are numerous bills to legalize marijuana medicinally, recreationally. There's bills about allowing it to go through the banking system. There's even issues with taxation of marijuana. That even though folks are, the federal government says that it is an illegal act, the federal government still wants their cut of the federal taxes, which is interesting because with this type of law, you can't get any tax breaks. So they're getting huge federal tax liens against them, and it's just an interesting relationship that the federal government wants the money, but they don't want to legalize it, or they don't want to actually deal with it. It was passed in last December that no federal funds would be used to enforce marijuana laws in legal states. So the federal government is really doing things, allowing things to happen, but not legalizing. It's an interesting process they're going through. The federal government did give us guidelines back in 2013 about some of the things that they're going to be watching for as they take this wait-and-see approach. The former Attorney General Eric Holder had 8 points that he was going to look at as they consider whether marijuana legalization was a success. And on this slide, the 8 points are listed there. They were going to look at whether marijuana is being distributed to minors. This is supposed to be for normally people over the age of 21. There's a couple states with laws over the age of 18, especially for medical use. Another point was directing revenue from marijuana sales to gangs and cartels. Is this something that cartels are getting into the legal business to avert the law? Also, diverting marijuana from states where it's legal to other states where there are no laws allowing for marijuana use. So if, and we'll talk about it in a second, Oklahoma and Nebraska are right beside Colorado, and are there problems? Is some of that marijuana getting outside of state lines, giving those two states a problem? And that is one point that the Justice Department is going to look at in their determination about whether legalization can go forward. Another point was using legal sales as cover for trafficking operations. So are you selling marijuana legally out the front and heroin out the back, or human trafficking or whatever else? Using violence and firearms in marijuana cultivation and distribution was another point they were going to look at. Driving under the influence of marijuana. They were going to study whether there was a rise in marijuana-induced crashes and those types of things. Growing marijuana on public lands also was deemed illegal and something they would prosecute. And possessing marijuana or using on federal property, which is interesting. Rocky Mountain National Park is a national park which is within the state of Colorado, so you can use it in Colorado, but you can't use it in Rocky Mountain National Park. So those are the 8 points that the Attorney General said that they were going to look at. And I go back to the next slide, which is the Oklahoma and Nebraska. Their attorneys general filed a lawsuit against Colorado in federal court. Each of those attorneys general said that the marijuana legalization was draining their treasuries and placing stress on their criminal justice systems. They were spending so much money, especially around those border towns, to enforce their own state's marijuana laws, that was bankrupting those local governments. So the attorneys general sued and are waiting to get a determination about whether this case will be heard. Well, I think it was last week, the Supreme Court asked for an opinion from the Justice Department whether this should be heard or not. What is their opinion on this? On legalization, on whether Colorado is giving undue stress to Oklahoma and Nebraska and their systems, and so this will be very interesting how the Justice Department and the White House respond to this ask from the Supreme Court, and it can go one of two ways. One is it's something that they do not see as a problem, and the Supreme Court will probably throw the case out, or they will say, yes, it violates one of our 8 points that we said we were going to prosecute, and the case needs to be heard. It could mean an awful lot for whether legalization goes forward or not. There was also another lawsuit brought against the state of Colorado by a group called the Safe Streets Alliance. They have a couple of folks who actually live in Colorado. They're Washington, D.C. based, but they live in Colorado. And one family claims that there was a drop in property values because marijuana dispensaries and marijuana stores moved into their neighborhoods and made their property value drop. Along with a business, a Holiday Inn in Frisco, Colorado, which claim that the marijuana legalization caused this Holiday Inn to see a loss of business. It's hurting their business. So there are lawsuits going on, and the only reason I bring the federal law up is many times, I've heard people say, well, they need to, get off their duffs and do something about legalization, make some kind of decision about it, help the states out one way or the other, and actually make a decision. But really, what we're finding to be until the federal government makes those types of decisions, there's actions that individuals can take, that organizations, and one of these is a local ordinance. the next slide. So, and a local ordinance, by definition, is a law usually found in a code of laws for a political division smaller than a state or nation. So it's a local government, a municipality, a county, a township, anything like that, where you can, kind of create your own rules and standards more at the local level on what's going on in your community than trying to change federal law, than trying to even change state law, which is tough many times. And next slide. And steps to a local ordinance. It's a lengthy process. It's not something that can be done in a week. Usually, it's not something that can usually be done in even a month. But it's much easier than trying to get the state or really a federal law change. It's almost, it's nearly impossible to get a federal law changed. Congress doesn't agree, and there's partisan issues and all of those types of things. And even state government takes those same types of approaches to this. But a local ordinance is, even though it's lengthy, is much easier than trying to do it the other two ways. It also could create kind of a hometown solution to a state or federal law if you don't agree with something. I know in Ohio there are some counties, there are some cities in our state that don't allow alcohol. They're dry towns. They don't allow bars. I actually live in a town that doesn't allow they can sell alcohol in a grocery store that could be carried out and consumed at home, but you cannot have a bar or a liquor establishment, including a restaurant, in our town. That's pretty rare. From what other city or other cities and villages have in Ohio, but it's something that my little hometown took care of something like 70 or 80 years ago. Also, it can give you the ability to address problems as a community. Too many times, I think, that people look at government and look at state legislators or federal legislators as being having to come up with solutions. But really, when a town, a community, a city, a block could come together and create a safer environment, an environment that is specifically targeted to whatever kind of population lives there, including the diversity and the cultures and those types of things. You can address these problems as a community, which really encourages community collaboration and partnerships. One of the interesting pieces about going against legalization in Ohio is that it has brought us into contact with people that we normally traditionally haven't spoken to, whether it be business organizations, some teachers unions, some even we deal with medical some, but not as closely as we do with this issue. So it gives us an opportunity to kind of reach outside of our comfortability and what is what's kind of natural and what we've done for years, and makes us work with others, which actually can only strengthen the community. And you don't have to agree on everything. One of the greatest pieces that I think that some college towns have experienced some successes is actually working with local bar owners on underage drinking and on server training and things like that. And even though they serve alcohol and those types of things, that some prevention organizations, are in, could be in contrast to, they still, they can be great partners. So this is something that that can actually tie a community together. I found a really, really nice toolkit from UDEC, And Derek, you may have to help me with what UDEC stands for. I know it's Underage Drinking Enforcement something. But UDETC, they had a local ordinance toolkit that kind of gives step by step, and we're going to put it on our website as a tool. But they have a local ordinance toolkit as just a step by step process, what you need to do to get a local ordinance passed. And some of the steps that that are in that toolkit. The first one is just meet regularly. That seems to be something that is forgotten about. But meet at a regular time, the same time, Tuesday at 2 o'clock. Everybody knows that meeting is set at that time. And also make sure that you have a sign-up sheet. That's, I think, one of the biggest mistakes that folks who are trying to get a local ordinance together, they forget to notate who is at these meetings. So someone may get left off, and that could be a potential extremely valuable partner that you don't want to leave off. The second step, according to the local ordinance toolkit, is strategize. Each ordinance might be different. Each community. Are you trying to do this through a city council? Are you trying to do this through a mayor? What kind of elected officials are you aiming at? Is this going to be an open vote that you would like to see on a local ballot initiative? So you have to kind of identify what those steps would be. Who are we trying to target in getting whatever ordinance change? And what is your scope of your ordinance? Do you want this as a township or a village, a county even, to get this, to get whatever it is changed? And then also sometimes local petitions have to be signed. You have to get a certain number of signatures and work through your your county department of elections or whatever it is, and you have to do that. Or do you just do a local ordinance through elected officials? Can it be done that way? So you have to know a little bit and get those questions answered. You don't have to know those questions up front, but as the more partners you gather, the better opportunities you have at doing things correctly. There's nothing worse than getting halfway down doing a local ordinance or something and finding out that the only way you can change a city or township rule is through local elections and not through a mayor or a township commissioner or something like that. So make sure that you understand what your community rules are. Number 3 is identify your allies and your adversaries. Who's going to help us? Who are those people that are going to be galvanized and strengthen us and speaking from the same playbook? But also make sure that you know who those folks are that's going to come out against you, because what you're going to have to do is come up with some arguments against. They're going to have some points against why this shouldn't go into effect, and you should have some talking points to combat that. I think we forget about that too. That not only do we identify friends, but we also have to talk about those who are not in agreement with us on this piece. And sometimes it is also just a conversation where no, we're not trying to do that, but we're trying to do this, and that could also change someone who might think they're against you into being one of your most valuable partners. Number 4, you have to have a little bit of fundraising to do these types of things, because you're going to need printed materials. You're going to need maybe some broadcast pieces. Maybe you need to buy some ads on social media, or also fundraising. If you can, if one of your partners in your local ordinance is a printer or something, or a graphic designer, that's going to save you money. It'll save you some money, save you some funds. So not only is it fundraising time, but it's also friend-raising time. Who can help out and who can provide those services, either free or at a reduced cost to help your local ordinance pass, to get the actual word out to everybody. Number 5. Make sure that you create a task list for your volunteers. There's nothing more frustrating than volunteering on something and not knowing what you're doing. People who volunteer want to make sure that they spend their time well, and that they're a valuable addition to whatever organization. And if they don't feel valued, they're not going to be around very long. So make sure you have this task list, not only for yourself, because it does help with your next steps and the different tasks that you need, but also it helps them understand, okay, here's my next step. And with that, it's a good opportunity to create committees for tasks as well, whether they be media committees or fundraising committees, or even creating or improving upon your statement, whatever your local ordinances you're trying to get passed. And number 6 is community outreach as well. Start preparing yourself a presentation. Why should people be interested in this, and how should you address them? And that doesn't mean one presentation. If I'm speaking to a business group, I'm going to talk about something, their bottom line, basically, how this impacts their bottom line and can either save them money or make their workforce more productive, something like that. So you have to come up with one. I wouldn't take the business one to a law enforcement, because they're different organizations, and they sometimes have different pieces that they focus on. Also, identify partner groups for your presentations. So, maybe you can get a business owner or two on your side. Maybe you can get the chief of police, whoever it is, and really work with them. And don't forget, when you go out and do presentations, to take a volunteer or a donor sheet. Maybe somebody might want to get involved. Man, this is a great idea. What can I do? Okay, we have a meeting Tuesday at 2 o'clock. Or, I can't make those meetings, but, here's $50 I can throw toward this. I really believe in what you're doing here. Number 7 is just distributing those materials, whether it be places of business, audiences who might be friendly to your cause, grocery stores, information fairs, any of those places that you see, where folks that you think are your allies in this, walking through or whatever else they're doing, make sure that you're there as well to help get them on board, not only for the cause, but also to show that you're actively working on this. Number 8 is drafting your resolution, which is sometimes overwhelming. There's a great tool from the University of Tennessee that we're going to put on our website called Ordinance Drafting and Enactment, and it's kind of a step-by-step guide that the university did to actually figure out how to draft a resolution. Just a wonderful tool, and something that might be able to help you out as you're drafting your resolution. And also, when you draft it, make sure that you meet with the township council or your city council or your mayor or whoever it is, whoever is leader in a leadership position, just to discuss your draft resolution. Obviously there are politics and everything. So, how is this going to be received by the leadership in our community? And how could they, maybe there's some things, maybe you need to take littler baby steps. Maybe they don't want to eliminate medical dispensaries, but they don't want legal pot shops in their community. So those baby steps that you can take are valuable, and just that basic understanding about what leadership will help support you on, or even help you out with, is extremely valuable. Number 9 is make sure that you have a communication plan with your supporters and the media, whether it's writing op-eds or letters to the editor, social media. Make sure you have a social media plan as well, and try to have weekly communication about the status to keep your supporters engaged. If they don't see something about it, they will forget about it. That's just human nature. That's not meaning that anybody's not on your side. It's just keep it in front of their face quite a bit. Number 10, if necessary, have that petition drive. What are those volunteers? I know that some folks at the state level will have paid signature gatherers. For local ordinances, is more of a volunteer type of effort. So, and identify where potential audiences might gather, so that you're not wasting your time collecting 2 signatures, but you know, standing by a lake. But instead, you might be, you know, in front of the grocery store or your local, you know, Walmart or Target or whatever you have in your town. Number 11, there possibly might be lobbying, which means that you're asking supporters to contact your city council persons, your mayor, to support your ordinance. You're asking them to vote on something, which is lobbying. So make sure you're either doing it in your off time, or that you have some money set aside, some non-restricted funds, so you can do that. And then also attend the city council meetings. Make sure that you're heard. Make sure that you're seen. A great time to address city council persons and those times is right after a meeting. Hey, is there any way I can sit down with you? Is there any way that we can chat about this? So it's a good way that to get your face seen and your idea understood. And then lastly, just follow through. You're probably going to have several meetings to get something passed in your community. So make sure that you get to those meetings. You don't give up. Keep positive. You have setbacks, especially when it comes to legalization, but you got to keep going because you're doing the right thing. You're doing the thing that means a lot to a community, and even though it can beat you down, when you're doing the right thing, you get the biggest reward at the end. There's a couple of different sample ordinances. We have one from the city of Hamilton, Ohio, which has outlawed medical marijuana dispensaries. Even though legalization has not hit Ohio yet, they have taken the foresight to actually make sure that those types of businesses are not allowed in their city. There's also a couple of ordinances from some cities in Colorado as well. So we have 3 ordinances that you can look at and see which one might fit your community, which one might be understood by folks in your community. So I will turn this back over to Derek, and thank you so much.
Okay. Thank you, Tony, and wanted to make you all aware of some resources that we have to kind of work within your community, and we have freshly developed that will be officially released on Thursday are some community sector sheets, and we'll talk a little bit more about that. Tony had mentioned the sample ordinances. We've also developed a marijuana quiz and an environmental prevention engagement activity. So with the community sector sheets, those will be released on Thursday to the general public. We'll have a link to that along with the recording to the webinar and all the other materials that we'll send out here as well. But we wanted to provide the information and have it specific to your community sectors that you might be working with, because as Tony pointed out, you don't want to have the same approach or ask with a business as you might want to have with law enforcement or with a school. So you want to be kind of specific. So the 6 sheets that we have put together are marijuana and business concerns. We've got a lot of support from the Chambers of Commerce because they're really concerned about the impact of marijuana on their constituents and the groups that they work with. Also, marijuana in the Colorado experiment, marijuana and crime. So often we see that, or we hear that so many people are incarcerated because of marijuana, and that's not necessarily the case, but there are some connections related to marijuana and other criminal behavior. Marijuana, mental health, and learning, which is a little bit different than marijuana and health. So the mental health and learning really looks at some of the cognitive deficiencies that can develop because of marijuana use, and then health is more broad, and then finally marijuana and youth. So again, those will be distributed largely on Thursday, and then they'll also be included within your information. Also, we have the marijuana quiz, and that I will send out, and that's also linked on the Drug Free Action Alliance website. And the marijuana quiz looks at 12 common things that you might hear within your community. Marijuana doesn't hurt anyone. Marijuana is not addictive. The potency of today's marijuana, kind of looking at that and how it's expanded over time. So it's set up in a PowerPoint presentation, and the purpose of that is for you to have those conversations with community leaders, with the parents in your community to really debunk some of the myths that they might so commonly hear, because that's really what the pro-marijuana folks like to lean into, and they're really debunked in pretty simplistic ways. And one of the ways that the marijuana advocates are so effective is that they put up the sick and dying people, or they want to focus on children. Well, we care about sick and dying people, and we care about children too, so let's make sure that we're being effective in our approach. So along that line with the marijuana quiz, 7 through 12 is really looking at just because marijuana may be natural doesn't necessarily mean that it's safe. Looking at that taxation issue of all the windfall of revenue that communities will generate if marijuana is legalized, and then again that prison piece that we spoke of. And then the final activity or piece that I wanted to share with you is related to engaging your coalition folks or other groups related to the 4 environmental strategies. So this is kind of a capstone of the 3-part series. So when you're looking for policies related to marijuana, really connecting with those and seeing what you want to focus on related to the environmental prevention strategies. So that will be another handout that we'll pass out. So now we've made it to our question and answer section. And if you do have a question, please ask it in the question section of your GoToWebinar navigation panel. It looks like we have about 7 minutes for questions, and we'll have to cut pretty close to 2 o'clock because Tony does have that other meeting where he is at currently. So thank you for Tony for taking the time with us today. So the first question is from Gilbert, and his question is, working in a big city like Los Angeles, what are the most effective strategies to address policy? And how best do we address enforcement of the policy? Tony, do you have any advice for that? Tony, are you still with us?
Sorry, what was the?
Oh.
You were break. Yes, you were break. I'm sorry.
Okay.
What was the question again? I'm sorry, you broke up a little.
Okay. Working in a big city, Gilbert is from Los Angeles. What are the most effective strategies to address policy? And then a follow-up to that is, how do we address enforcement of a policy?
I think working the smaller that you can, I think, is the more. It's the easiest direction to go. Trying to get a law passed in Ohio or California at a state level. Even we don't look at even city of Columbus. We're looking at whether it's Worthington, which is something that a much smaller burg of Columbus proper. Something like that. So going, small could be something that could really work well for you. Those people know you. If you had to go to the LA City Council or Los Angeles County commissioners, they don't know who you are. They might, but in a city that large, there's a good chance that they don't. So going smaller would be easier. And just getting those partners and those people that on your side right at the beginning. Also, law enforcement and medical personnel seem to carry an awful lot of weight in our communities. So I would focus on those folks first off as well. And the second part of the question, what was that, Derek?
It was related to enforcement of policies. So how can you work to ensure that policies are effectively and evenly enforced?
I think the way that you can get policies enforced, it comes down to basically your community and being in touch with those, whether it be law enforcement officers. Another valuable piece that has happened here in Ohio is having them actually enforced by your local business. There was a lady who wanted to have a ban on one of the cough medicines, and she didn't work with law enforcement. She worked with her local business, and ended up giving them a community partner award, and working those valuable. Making them feel valued and being a part of the solution is what every business wants to be a good community, a good community partner. So I would even work from that, because I know especially around campuses, maybe it's reaching out to bars instead of your campus police. So I would think outside the box on how to get those laws enforced.
Thank you, Tony. The next question is from Kathy, and has anyone worked on an ordinance banning or limiting butane sales? Tony, I'm not familiar with anything, but didn't know if you would be.
No, I have not known of anyone to work on those. That's actually really, really good. A really good way of looking at something, because the butane and the honey oil and those types of things coming from marijuana is extremely dangerous, and I think could be something that that folks could get on board about, especially seeing some pictures say 1,000 words, and you get some of those pictures that we found where houses are blown up or apartment complexes, but I don't know of any ordinances that have outlawed butane. You'd have to make it really, really kind of specific, because butane is used in other means. So you would have to kind of be real specific about it. But if there's ever anything, we'll put it on our website, because I think it's a great question.
Okay, and this question is from Jackie, and you spoke a little bit about the illegality of growing on federal property. Do you know what the restrictions might be related to tribal lands?
Actually, the federal government just opened up that you're allowed to grow and sell on tribal lands right now. They just gave Native Americans the opportunity to do that. So really, it's kind of an open market right now for tribal lands.
Excellent. And this is a follow-up question from Gilbert, and his question is, and this is also related to Viviana's question. Viviana's is, I heard that in Massachusetts, when medical marijuana was legalized, towns tried to create local ordinances trying to prohibit the opening of medical marijuana dispensaries. And then the Attorney General came back saying that it was against marijuana law. Can you speak to that? I'm not sure if you know about Massachusetts, but what are some of the restrictions of the ability to pass local ordinances that might be more stringent than state law?
Well, what's interesting is that there are some local ordinances. I'm guessing that Massachusetts language might have actually said that there are that you can't have a local ordinance. I know the legalization amendment in Ohio would actually prohibit not only any ordinance that they have in the future, but also would supersede any ordinance that has already been established. So it's all according to how the language is written, and if the Attorney General has said that that would be breaking the law, then somewhere it must be in the language that that you can't prohibit medical marijuana dispensaries or nonprofits. We have to remember that 71% of Colorado does not legalize. 71% of all municipalities in Colorado have not legalized marijuana. So their language is different, and you have to go to each state to figure out, is this something? Because it's usually just one line that makes the difference in whether you can ban medical or recreational facilities in your community.
Thank you, Tony. And just one quick question before we let you go. How can you find if there is a law in place in your city or township?
If you contact your the city auditor, should have those types of things. In city government would be the way, or township. One of your township trustees, one of your whatever kind of municipality you're looking for, you'd have to contact usually the auditor or something like that.
Okay. Thank you, Tony. We know that you have a meeting at 2, so we'll say goodbye. Thanks again for your time, and I will finish the remaining of the questions here and talk a little bit more about what we have upcoming. So thanks again, Tony. For the remaining question, is the UDEC toolkit available to us, and is there a cost? And that question is from Libby. The UDEC, which is the Underage Drinking Enforcement Training Center, that toolkit is available through the UDEC website at www.udetc.org. drugfreeaction.org, and we will also be providing it to the link with the follow-up materials, which will also include that certificate of attendance that we will send out as well. So for Virginia and Tia, who asked about that, yes, we will definitely get that certificate of attendance out to you. And then the final question was related to the webinar. Yes, it has been recorded, and it will be sent to you post-call. And just wanted to provide you with our contact information. So if you have additional questions specific to your community or other sample ordinances beyond the 3 that we'll be sending, you can contact Tony at 614-540-9985, extension 17, or me at the same number, extension 16. And you can also contact us here at drugfreeactionalliance.org. Thank you so much for this time for us today. Again, we'll send that information out to you by Friday. So if you have additional questions or need additional information, just let us know and we'll be happy to assist. Thank you again, and thank you for enjoying or for participating in this 3-part webinar series. We've greatly enjoyed it, and so hopefully you have too. Thank you and have a wonderful day.